Hi, people in the jaw world. It's March 2nd. I'm giving you guys some of my voice is really gone. I had a crazy weekend. Um, I'm giving you guys an update about my appointment I had with my oral surgeon on Wednesday. It was informative. My doctor, my surgeon is very, very intelligent, obviously. He's also he said I was very intelligent with I was intelligent about knowing a lot of the situation that I'm in and the terminology I'm using and what I don't have. I'm very aware of my own condition, my own symptoms. It's almost like I was prepared to go to this meeting, this appointment, because I feel like I need to educate myself before I go to someone and they talk to me about a condition that I have. So for me, it's important to know what I'm dealing with, what's normal, have the correct verbiage for everything and vocabulary for everything so it's easier to explain and the surgeon has a clear understanding of my condition. Um, in addition to that, so he also did some measurements and analyzed my relaxed bite. Because I have an open bite, my lips naturally are open when I'm relaxing, which is a problem, and that's because my teeth don't overlap because there's a gap in the middle of my bite. So he was doing a measurement of that, which to me was this. So that's relaxed, like I'm not trying, and he was measuring that. He said it was a pretty big thing going on, but he also said that it's weird because you can see my front teeth when my lips are relaxed. A lot of people with an open bite, it's like all up here, and it looks like they don't have front teeth. But for me, I have a protrusion, which means that I have an open bite, but my front teeth are more ahead. My jaw is more ahead of my bottom jaw. So they're on the same plane. You can still see my front teeth when they're relaxed, but when I close it, I get dimples. It's called straining. You know, if you have to strain to close your lips, that's an issue. It's tiring, and you also become subconsciously you become a mouth breather because if you're comfortable when you relax and your mouth is open, you're going to breathe through your mouth more than your nose, um, which is true sometimes. So anyway, he did a lot more measurements and said that I'm definitely going to have the upper jaw surgery done because I obviously have issues. So he's going to take several weeks to get everything together, get everything sketched out, get everything calculated to see what my treatment will be as far as the surgery goes. So he also said that since my palate isn't that bad, he's going to do surgery for the palate expansion in the upper jaw surgery itself. So with that being said, I won't need braces for that long because my teeth are nice. He was really obsessed with my teeth. He thought they were like beautiful teeth. I'm just like, haha, thanks. Like, I'm obviously here for a reason because if you're at an oral surgeon's office, you probably have an issue, but it's not because of my actual, like, my teeth are the cosmetic reason of why they don't work, but my jaws are fucked up. So, he was just like, yeah, your teeth are beautiful. It's crazy. So that means that you won't have braces for that long because we're not prepping you for a palate surgery before your actual surgery. So we're going to get them as straight as possible, but everything's going to be done instantly. Like, he's like, the surgery takes the shortest amount of time. It takes 2 to 3 hours. And after that, it's like all the preparation, the work after, it's going to be crazy. Just because you have to have braces after surgery. That's where all the fine tuning is. So, the braces before surgery prep your teeth as good as they can so that they can fit over top each other, So, but I'm getting the palate expansion surgery, so they don't have to be perfect because they're going to move anyways. Um, they're going to go out, and I'm going to have a gap, like a really big gap in the middle here. And then the braces after the surgery will close that gap, and voila, in months hopefully they will be perfect. I told him I was a designer, and if they're not perfect, I'm going to freak the fuck out. I'm just like, if I'm going through all this, I will wait another 2 months with the braces to make sure they're perfect. I'm not going to rush through anything. Because financially it's not a joke either. So, but when he does the sketches and gets everything done, he has to meet with my orthodontist to talk about treatment, and then I will meet with them they'll discuss it with me, and we'll move forward, get the braces on. Luckily, my surgeon, some surgeons don't know your orthodontist. Literally, they'll have like a Skype session and go over your treatment. My orthodontist, luckily, collaborates with my surgeon a lot, and my surgeon goes to that office a lot to treat patients. So the thing I'm waiting for is for him to get his conclusion together, of what I'm actually getting done, and then he's going to discuss that with my orthodontist to talk to me. So I will get a phone call from them when they're ready to meet with me. What else? He doesn't know if I'm going to get the lower dress surgery yet. He honestly has to do the mapping and the drawing and everything. So he did say didn't have a prominent chin in general, like even bone structure wise, like it doesn't stick out. It's not even because of my jaw being weird, it's just that I don't really have one. But that reason was for him, when you look at my face, everything lines up like this. Like there's no definition in anything here. Like it's all, like my face is very long. Like he kept saying, like this area of your face is long. I don't want to change your face, because there's things you can do in the surgery to like manipulate it so you can make a face look more like a face, and proportionally everything's sound and happy. But he said with mine, like it's not really, he doesn't have to do many changes. It's just that he wants to make sure my teeth are in the right spot and my jaw is in the right spot, which means I might not look that, transformed as I thought, which is kind of good, but I'm speaking too soon because I don't know if I need a lower jaw one yet. So after all this, I also got a new job 2 days ago, which means that I might be getting new insurance, because this one is better than the one I'm on right now. Like it's only $60 a month for the highest premium. Like what? So that's like a third of the price of one of my inhalers I'm buying on my current plan. Which complicates things, because then the insurance company, if I'm getting a surgery like this, that's a pre-existing condition. So I might have to stick it out with this insurance company that I currently have until I am done with the treatment with my jaw. So I'm going to have to dig deep and find out some information about that, because if I need to do that now, then I have to do that now and get everything lined up. So other than that, I'm still wearing a splint when I can. I realize that they already have everything they need. It's just that it helps me function better. Like I'm not in as much pain when I wear it. But yeah, I mean that's pretty much it. I'm waiting still. I'm still waiting for things to happen. So it's just a crazy process that hasn't even started yet. So yeah, that's all I have, I think, right now. I'll let you guys know what any verdict is, because it's going to be a couple weeks, so I'm trying not to be as obsessed about it, because the more I'm obsessed about it, I get anxious, and to me it takes longer. It's a longer process when you're actually counting the days instead of living your life. So yeah, anyway, so I'll let you guys know what's up with that and keep you in touch, up to date. Talk to you guys later.